how to switch from Medicare Supplement to a Medicare Advantage plan. In this video, I'm going to explain why many folks make that change and also how to exactly go about doing it. So why would you want to change from a supplement plan to an Advantage? Well, perhaps the supplement plan has gotten so expensive that you can't afford it anymore. Unfortunately, everybody knows with inflation, everything's gone up, including your insurance. So if it's no longer in the budget, we can take a look at why changing from a supplement to Advantage would make sense. Also, you can use your Medicare Supplement trial right, which I'll cover later in the video, which allows you to try out a Medicare Supplement plan without any risk. It really just comes down to price, saving money, and also the Advantage plans do offer extra benefits, dental, vision, hearing, and it includes the prescription coverage. So changing from a supplement to an Advantage can make sense. So the Medicare Advantage trial right allows you to try out a Medicare Advantage plan. It only works if you've never had a Medicare Advantage plan before. So how it works is, let's say you have a Medicare Supplement plan now, and you want to try a Medicare Advantage. Well, you can go ahead and enroll into an Advantage plan, cancel your old supplement plan once the Advantage plan has been approved, and then you have 12 months to try out the Advantage plan. If you don't like it, you can go back to the same exact supplement plan you had before with the same exact carrier, no health questions asked. So that allows you to try out an Advantage plan risk-free. Because if you don't like it, you can always hop back into your supplement plan, no health questions asked. In other scenarios, you would normally have to answer health questions and can be denied by your supplement carrier. So if you're thinking about trying out an Advantage plan and you've never had one before, using the Medicare Advantage trial right is a perfect way to do so. Now, normally you can only change from a supplement to an Advantage plan during the annual enrollment window, also called AEP, which runs each year between October 15th and December 7th. During this time, you can make changes to your drug plan. You can sign up for an Advantage plan. You can change your Advantage plan. You can also move from a supplement to a Medicare Advantage plan. Also, if say you're moving, you have a supplement plan now and you're moving, and you have a standalone prescription drug plan. Moving out of state with the prescription drug plan does allow you to purchase a Medicare supplement plan using a special enrollment period. So that's another way to sign up for an Advantage plan if you're outside of the annual enrollment period. Make sure you check out my video, Moving with Medicare, to learn more about what happens when you move with a Medicare plan, whether it's a supplement plan, drug plan, or an Advantage plan. Now, when you're signing up for a Medicare Advantage plan, it's actually really easy. There's no health underwriting like there is with a Medicare Supplement plan. You simply just fill out an application, send it to the carrier, and it normally will get issued if you're signing up during a valid election period, such as annual enrollment period, or if you have a special election period, such as moving, like we talked about, or something else that qualifies you to sign up for an Advantage plan. But before you sign up, you want to make sure you're picking the right one. So be sure to check out my video, how to choose a Medicare Advantage plan. You want to input your doctors, input your medications, go over what's covered, understand what's not covered. There's many moving parts in an Advantage plan. So you got to take your time, make sure you choose the right one. And we can help you with that. Just give us a call at the number below. We'd be glad to help you out. Now, it's very important to be sure to cancel your old Medicare supplement plan once the new Advantage plan has been approved. Now, I say this again, you have to cancel your old supplement once the Advantage plan is approved. If you don't, what happens is the Medicare Advantage plan becomes primary to Medicare and takes over. So that means when you go to the doctor is going to bill your Advantage plan, not original Medicare. So you no longer have original Medicare when you have an Advantage plan. So if you keep your supplement plan, you're still paying the premium, that supplement plan will be paying no claims. So you're essentially throwing money out the window if you have a supplement plan and an Advantage at the same time. Again, because the doctors cannot bill original Medicare, they will be billing the Advantage plan as the Advantage plan takes over and becomes primary. So once the Advantage plan is issued, you simply have to call your old supplement carrier and cancel that out. And then when you go to the doctor, you'll be presenting your Medicare Advantage card, not your original Medicare card. So let's say you go into a doctor for a checkup or an annual visit and you have United Healthcare Medicare Advantage plan, you'll present that card to the doctor and let them know to bill the Advantage plan and let them know that you no longer have original Medicare. So it's very important. Also, you want to make sure your doctors are in network. We already talked about choosing the right plan, but once you're signed up, if you have to go to new doctors, you want to make sure those doctors are in the plan's network. Whether you have an HMO or a PPO, you need to make sure you're inside the plan's network to make sure that you're getting the lowest out-of-pocket cost sharing available on the plan. So if you need help picking out an Advantage plan, or you have questions making the transition from a supplement plan to an Advantage plan, or you have questions on using your trial right, give us a call at the number below, or you can book an appointment in the description, and we'd be happy to go over options with you. Thanks for watching the video. Be sure to click like and subscribe below, and we'll see you on the next one. Thank you.